Hi, I'm Dr. Dan Shapiro. I'm a board-certified plastic surgeon in practice since 1992 in the Scottsdale and Paradise Valley area. And I am here to talk to you today about a frequent question that people ask me when they come in for a consultation patients that have had their facelifts done by another surgeon, and can I help them if they're unhappy? Can I fix what they feel to be unsatisfactory results? Facelifts are very technique dependent, and the days are or should be over where you can really see that a facelift has been performed. A facelift, when done effectively and technically with expertise, should be your secret. I think the incision should be hidden. I think someone sitting across from you at dinner or talking with you intimately should have no idea that anything has been done. And unfortunately, I see many patients that come in that have had facelifts done either locally or throughout the country or throughout the world that are very unhappy because they have telltale signs of facelifts. So what are those telltale signs? Oftentimes people have visible scars along the ears or behind the hairline. They have a distortion of the ears. We call that a pixie ear, where the ear looks a little bit like an elf along the bottom. And there's distortion of the way the face looks, either in repose without any expression or when smiling. And my heart really goes out to these patients because I know a lot of time and energy is spent along with the financial expenditure. So it really should be able to be turned around. I think the most important thing to understand is it can be fixed. But I think that patients that come in to see me, I have to explain to them that they have to be patient with regards to allowing time to pass so the scars heal in a way that I can revise them. And what is that time frame? Usually somewhere between 6 months and a year. For people that have had real distortion or are very unhappy with the way that their faces look, oftentimes it's because the skin has been pulled too much or it has been pulled too tight. And how I fix that is I do a different technique where none of the skin is pulled. I actually elevate the facial fat and create a more voluptuous shape in order to make someone look younger and prettier. So the answer to the question is yes, it can be fixed. Oftentimes it can be done at about a year, sometimes before, and unfortunately people tend to have to start over. It's something that I enjoy doing quite frequently, and I think some of my most satisfied patients are those people that have had their facelifts redone. What sort of questions should you ask when you come and see a plastic surgeon? You should ask someone how they do the surgery. How is it different than what you've had done before? I think you should also ask your plastic surgeon how often they revise facelifts, how often they see and perform facelift surgery in patients who had previous facelifts. I think you should also ask to see their before and after patients in terms of photographs, specifically asking to see photographs of patients that have had their facelifts revised by me or whoever you're talking to. So in summary, I think that facelifts can be revised. Unfortunately, you have to wait a while for the scars to heal and mature. And I think the end result can be quite satisfying as long as it's performed in an expert fashion, utilizing contemporary techniques, often with fat transfer, and taking the tension off the incisions. Thanks a lot.